Um, so I suppose when it comes to the low back, and I want to talk about this in particular because it's definitely something that people think about differently. When it comes to the low back, people find it a bit more difficult, I think, to appraise pain. So, is this on the injury spectrum or is this on the successful workout spectrum? So when someone goes to the gym and they get a ruthless pump in their biceps and their biceps are burning and they're sore the next day, it's generally a positive thing. People are pretty happy about that, unless maybe you're a waiter and you have to carry, trays all day and plates all day the next day. You're probably pretty happy about the bicep pain. You're probably pretty happy about the pain both within and after the workout. Now, when it comes to the low back, people are generally a little bit more uncertain. They might stop their workout because their low back is getting sore, even if it just feels like a really intense pump. And to be fair, that can be very uncomfortable sometimes, and it can definitely limit your performance. But if you're just getting a pump in your low back and your back is painful during the workout and painful after, but it's very specific to the muscles, it seems to be very clearly activity related in that you were doing an exercise working the low back muscles, and it's going away after a normal expected time frame of delayed onset muscle soreness, let's say 2 to 3 days, 1 to 3 days, then I wouldn't be worried about that in the slightest. Now, if it's the case that maybe you've got pain that is more severe, not activity related, so you've got this pain that immediately came on during an exercise and it's maintained, it's not, it's just present even when you're sitting and stuff, of course, that's something that you'd be more concerned about. And if there's something like pain that's mainly on one side, let's say, or you heard a crack or a pop, or you got a shooting down your leg, or you've got burning or tingling or something like that, those types of things are different. They're more on the pain spectrum. But I think that it's really important to realize that getting, soreness in your lower back muscles during a workout and after a workout is an entirely normal part of the training process, particularly if you're doing exercises like deadlifts, squats, bent over rows, or any other exercise that involves you loading your lower back. Now, with that said, if that's becoming the limiting factor for performance and it's not the primary training target, like in a squat, let's say, then maybe there's something that requires modification. Easy examples of that would be someone who maybe they start off their squat in a really exaggerated arch. So they're like got a total curve in their spine. Their muscles are really short. They feel contracted from the get-go. And then as they drop down into the squat, they end up in a really rounded position because they started really arched and they end up really rounded, really flexed. And as a result, their low back muscles are working loads throughout the repetition, throughout more of their contractile range, rather than just kind of staying isometric like they would often do. And as a result, that might actually be something that you end up modifying. You might want to maintain a more neutral spine, focus on bracing through your core entirely, rather than just using those low back muscles. So there's certainly technical changes that can be made to reduce soreness where it shouldn't be the limiting factor. But yeah, they're just some of the notes on the low back. Again, the guidelines vary for all different muscle or different injuries, but that's the primary thing that I think is really important to note when it comes to the lower back, that some degree of soreness is normal, just like any other muscle group, but there might be some characteristics that push it along that injury spectrum.
Yeah, and I think like the actual quality of the pain can help you understand this a little bit more, but you have to be somewhat objective with it, and pain is somewhat of subjective, so it's very hard to do. But like, for example, if you are doing a set of squats and all of a sudden you hear a pop and in the bottom position and you lose power to your leg and you're like struggling to rack it, and then like you can't really feel your leg, it's like that's obviously a different injury, or that is an injury, versus you waking up the next morning and having a really tight lower back and thinking you're injured. So it is hard to tell you, oh, this is the protocol to do in this case, when they're all so different. And it's not like, oh, we can only injure this area one specific way.
Yeah, absolutely. And I mean, when you're dealing with more specific, like I guess when you're listening to this podcast, like don't use this for like diagnostic purposes. Use it for big picture thinking and principles as it relates to injury. But if you're currently sitting at home and you're like, you know what, I got to be the tingling down the leg. I heard a pop yesterday when I was working out, not sure what I should do with my low back. Like, go and see a professional. You know, you go and see a professional if you got a specific injury. These are just kind of general principles that apply on the big picture level.